Hi friends, once again welcome back to my channel Mugambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam, also MHSRB Telangana Nursing Officer exam and other Nursing Officer exam. We are discussing questions from Pediatric Nursing. Two set of questions we already discussed in the first and second video, and today we can continue the same Pediatric Nursing question. And the first question, the premature closure of the sagittal suture is called. Options: option A, scaphocephaly, option B, oxycephaly, option C, acrocephaly, option D, anencephaly. And the correct answer for this question is option A, scaphocephaly is the premature closure of the sagittal suture. We can see the meaning of other options. First one, scaphocephaly, that is our answer, is the premature fusion of the sagittal suture. And the next one is oxycephaly. Oxycephaly means it is the premature closure of coronal suture. And next option, acrocephaly, it is the premature closure of the lambdoid and coronal suture. And next one is phagocephaly, it is asymmetrical distortion or flattening of one side of the skull. And the last one is anencephaly. Anencephaly means absence of major portion of the brain. Okay. Move on to the next question. Which drug may help to descend the testis into scrotum? Options: option A, HCG, option B, estrogen, option D, progesterone, option D, LH, luteinizing hormone. Our question is, which drug may help to descend, or which hormone therapy helps to descend the testis into the scrotum? And the correct answer is option A, HCG. The HCG increases the production of testicular androgen like testosterone, which helps to descend the testis. So the correct answer is HCG. Move on to the next question. The urethra which opens on the dorsal surface of the penis is termed as. Options: option A, epispadiasis, option B, cryptorchidism, option C, hypospadiasis, option D, anorchidism. Our question is, the urethral opening on the dorsal surface or upper side above the side of the penis is termed as epispadiasis. Upper, above, it is known as epispadiasis. Option A is the correct answer. Second option, cryptorchidism. Cryptorchidism means undescended testis. And the third option, hypospadiasis, means the urethral openings are situated on the ventral surface or under the surface of the penis, that is known as hypospadiasis. And anorchidism means congenital absence of one or more testes is known as anorchidism. Here our question answer is epispadiasis. Move on to the next question. Urethral openings located behind the penis is known as. Options: option A, epispadiasis, option B, phimosis, option C, hydrocele, option D, hypospadiasis. Previous question was urethral opening on the dorsal surface. This is urethral opening located behind the penis or ventral surface of the penis or under surface of the penis is known as hypospadiasis. Option D is the correct answer. And the second option, phimosis, that is also important question, that is inability to retract the foreskin of the penis is known as phimosis. And the treatment for the phimosis is circumcision, that also important question. Move on to the next question. Eruption of first molar permanent tooth occurs at which age? Options: option A, 4 to 5 years, option B, 6 to 7 years, option C, 7 to 8 years, option D, 8 to 10 years. Eruption of permanent teeth and temporary teeth is there. Here question is permanent teeth. Eruption of permanent teeth occurs at the age of 6 to 7 years. Option B is the correct answer. But the eruption of temporary teeth occurs by the age of 5 to 8th month. Move on to the next question. 90% of brain growth is achieved by the age of. Options: option A, 1 year, option B, 2nd year, option C, 3rd year, option D, 4th year. The 90% of brain growth is achieved by the age of 3rd year. Option C is the correct answer. Move on to the next question. In spina bifida, head circumference is measured to detect options. Option A, microcephaly. Option B, cerebral edema. Option C, hydrocephalus. Option D, all of this. Here the question is why to measure head circumference in case of spina bifida. So what is spina bifida means? This is a central nerve system defect result from failure of the neural tube to close during the embryonic development. So that neural tube is failed to close during the embryonic period. It's known as spina bifida. And the assessment, what are all the things we will assess in case of spina bifida means we can see visible spinal defect and also flaccid paralysis of the legs and altered bladder and bowel function, hip and joint deformities and hydrocephalus. So in order to assess the hydrocephalus, we have to take the head circumference in case of spina bifida. So the correct answer is option C, hydrocephalus. Thereby we can measure the head circumference and also assess the anterior fontanel for fullness. On to the next question. Best disinfectant used for cholera stool is options. Option A, bleaching powder. Option B, cresol. Option C, coal tar. Option D, formalin. Our question is which solution is used to disinfect cholera stool? It is cresol. Option B is the correct answer. Move on to the next question. A 4-year-old child is diagnosed with mucocutaneous lymph node syndrome or Kawasaki disease. The child is admitted to the pediatric unit and the nurse perform an initial assessment. What clinical findings support this diagnosis? And our options. Option A, strawberry tongue. Option B, copious discharge from the eyes. Option C, insidious onset of low-grade fever. Option D, maculopapular rashes on the extremities. Here the question is, a 4-year-old child is diagnosed with Kawasaki disease or it is also known as mucocutaneous lymph node syndrome, and this child is admitted in the pediatric unit. So what clinical assessment does the nurse confirm this diagnosis? So we have to know here what is Kawasaki disease and its clinical manifestation. So then we can easily answer this question. Kawasaki disease is also known as mucocutaneous lymph node syndrome and is an acute systemic inflammatory illness. Okay. Its cause is unknown. It's an acute systemic inflammatory illness. Its manifestations include conjunctival hyperemia, red throat, swollen hands, rashes, and enlargement of cervical lymph node, then cracking in the lips and fissures, joint pain, cardiac manifestations, and fever. Acute inflammation means fever will come. So here the correct answer is strawberry tongue. Option A is the correct answer. That means patient may have or children may have red throat and swollen tongue, and tongue is coated and it is enlarged and reddish appearance. So strawberry tongue is the main clinical manifestation of this Kawasaki disease. Move on to the next question. What is the most important nursing intervention for a 3-year-old child with a diagnosis of nephrotic syndrome? Options. Option A, regulating diet. Option B, encouraging fluids. Option C, preventing infection. Option D, maintaining bed rest. Here the question is, a 3-year-old child is diagnosed with nephrotic syndrome. What is the most important nursing intervention? And the correct answer is option C, preventing infection. Here we can see what is nephrotic syndrome. Nephrotic syndrome is a kidney disorder characterized by massive proteinuria, hypoalbuminemia or hypoproteinemia and edema. This is the classical manifestation of nephrotic syndrome. This is very important point. After diagnosing the nephrotic syndrome, immediately we should start the corticosteroid. So corticosteroid therapy is prescribed as soon as the diagnosis has been determined. So monitor the child closely for signs of infection and other adverse effect. Here our correct answer is preventing infection. Option C is the correct answer. Move on to the next question. A healthcare provider lists order for a young child with tentative diagnosis of Wills tumor. Which order should the nurse question? Options. Option A, MRI. Option B, CT scan. Option D, renal biopsy. Option D, abdominal ultrasound. Here the question is, a child is diagnosed with Wills tumor. Among this option, which diagnostic test is not needed for the child? Or in the list of order of this young child with the Wills tumor, which order should the nurse question why this test is performed for this child? Okay, and the correct answer is, it is a renal biopsy. Option C is the correct answer. A renal biopsy is an invasive procedure. Suppose if you are doing renal biopsy for a child with Wills tumor, there is disruption of the tumor will occur. This disruption causes metastasis. So renal biopsy will not perform for a child with Wills tumor. So the correct answer is option C. Move on to the next question. A child undergoes rehydration therapy after having diarrhea and dehydration. A nurse is teaching the client's parent about dietary management after rehydration. The nurse understands that the teaching plan has been successful when the parents tell the nurse that they will follow which type of diet. And our options: option A regular diet, option B clear liquid diet, option C full liquid diet, option D soft diet. Here the question is, a nurse is giving dietary education or dietary teaching on a child who undergone dehydration therapy after diarrhea and dehydration. Which type of diet is good for this child? And the correct answer is, it is a regular diet. So after diarrhea and dehydration, the patient can take a regular diet. No need to take clear liquid diet or full liquid diet and that. So they can take a regular normal diet to maintain the health. Move on to the next question. When obtaining a history from the parents of a child diagnosed with diarrhea due to salmonella, the nurse should ask the parents if the child has been exposed to which possible source of infection. And our options: option A non-refrigerated custard, option B unwashed vegetable, option B uncooked eggs, option D unwashed fruits. Here the question is, a nurse is taking history from a parent of a child who is diagnosed with diarrhea due to salmonella infection. Among this, which one is the possible source of infection for this child? And the correct answer is, it is from uncooked eggs. Option C is the correct answer. Uncooked egg is one of the main source of infection of salmonella. Move on to the next question. Most commonly affected heart valve in rheumatic heart disease. RHD means rheumatic heart disease. Options: option A aortic, option B mitral, option C pulmonary, option D tricuspid. And the correct answer is, it is mitral valve. Option B is the correct answer. Today again we discuss some of the important questions from pediatric nursing. Surely these questions and important points will helpful for your exam preparation. If it is useful for your studies, please share my videos to your friend circle.